Mr. Chair, I rise today to tell the sad story of Daniel Desnoyers, who took his own life because he did not have the money to buy the basic drugs that he needed for his mental health issues. Daniel Desnoyers was a young man who struggled with depression and psychosis, mental health issues that show no physical symptoms but take a deep psychological toll on those that they afflict. Daniel did the right thing. He purchased health insurance through the New York health insurance marketplace from Fidelis, a subsidiary of massive international conglomerate Centena Corporation. In March, Daniel went to the pharmacy to refill his prescription for risperidone, an antipsychotic medication that he needed. He was informed by the pharmacy that he no longer had health insurance, and the 1-month refill would cost him $250. Now, to some people, $250 may not seem like a lot of money, but to Daniel, it was. And according to a 2018 study by the Federal Reserve, 40% of Americans would not be able to cover an unexpected $400 expense. Daniel, unfortunately, was one of them. So he did not buy the medicine, and he began to ration his antipsychotic medicine, taking it every other day until he could get his insurance back. He contacted his provider, Fidelis, at the beginning of April when he learned that they had canceled his plan because he missed a $20 payment. Fidelis didn't immediately reinstate the plan. Instead, the company informed him that his coverage would not resume until May 1st. This meant another month without a refill of his prescription, another month without the medicine Daniel needed to function. His ration of medicine had run out. On April 9th, filled with thoughts of suicide, a listed side effect for antipsychotic drug withdrawal, Daniel superglued his seatbelt shut, posted a farewell message on Facebook, and drove his truck into the river, ending his life. Daniel Desnoyers died at the age of 29 because he was late paying $20 to a corporation that pulled in more than $60 billion in 2018. Something is deeply wrong in this country where we let a young man die because he cannot afford medicine that he needs, and when his insurance is taken away because of a $20 missed payment. Daniel died because we have a system that puts profits over patients, a healthcare system that does not guarantee basic care for all people is a healthcare system that is broken. Medicare for all could have prevented Daniel's death, and it could prevent the death of so many others. Lloyd Doggett's pharmaceutical bill that would hold these pharmaceutical companies accountable could have prevented Daniel's death. 28 million Americans are still uninsured, and millions more are saddled with high deductibles and high premium plans, which lead them to forego the care they need. Medicare for All is the plan that will guarantee every American the basic care that they have a right to. Daniel Desnoyers wasn't a perfect man. He didn't lead a perfect life, but he tried. And our nation owes it to him and others like him to make sure that they have the medicine they need to live with dignity. I will continue this fight for Daniel, for his father, for his family, and for all Americans. Thank you, Mr. Chair. I yield back my